everyone. Welcome to Digital Health Talks, Changemakers are focused on fixing healthcare. I'm Megan Antonelli, and today we're exploring the critical role of human factors engineering in healthcare AI implementation, examining both the remarkable successes and unexpected pitfalls that emerge when AI meets real-world clinical practice. I am excited to have Kristen Miller here today. She is the co-director of MedStar's Health Center for Diagnostic Systems and Safety and scientific director of their National Center for Human Factors in Healthcare. As healthcare organizations invest billions in AI technologies, Kristen's research reveals that human factors engineering, the science of how humans interact with complex systems, determines whether AI becomes a safety enhancer or a safety hazard, whether patients embrace or resist these tools, and whether healthcare teams achieve promised efficiencies or face new workflow disruptions. Hi, Kristen. How are you?
Great. Thank you, Megan. It's a pleasure to be here.
Yes, it's so fun to have you on the show. I know you've been a frequent speaker at HealthIMPACT, and you do such a great job and such great work at MedStar that I'm excited to chat today to see what you've been up to. We've talked a lot, sort of offline about kind of what you do and your role there. But if you could just tell our audience a little bit about, what your work kind of centers around with respect to human factors and AI. Let's start there.
Sure. Yeah, human factors, I think, is a pretty broad way to talk about systems engineering, all of the different factors that could go into any new initiative or implementation. So our team really takes that systems approach. We're looking at the people, the tools, the tasks, the built environment, the policies, the organizational culture, and really trying to understand the opportunities that AI is bringing, but also the potential challenges. And if we can get ahead of them to ensure both patient safety, but also the impact on providers, as well as a system level. Everyone's looking to buy the best new shiny AI thing. And so we apply some scientific rigor to understand how we can do that in the best way possible.
Yeah, no, and I mean, I think now that the conversation has really shifted towards AI, we certainly, we met and we're talking a lot more about, just technology in general and kind of what that impact on patient safety. But when you're looking specifically at healthcare and AI's implementation, what are some of the kind of positive impacts or areas where that's become kind of an opportunity for human factors?
Well, yeah, I think there's plenty of success stories we see when AI is designed using that human factors approach. The tools really fit into the workflow instead of asking people to fight against it. And so we can see things like enhanced decision-making, improved teamwork. The reduced cognitive load is huge when it's helping to support decisions and attention. I think most of the metrics that we're seeing in healthcare are focused on the provider and the system level. So we look at things like reduced documentation. We talk about pajama time, how much documentation providers are doing when they get home after a shift. We can look at things like throughput. Are we able to get people in and out of an urgent care faster? Streamlining tasks. There's certainly a lot of operational administrative things that AI is helping to support. Those are all really important metrics. I worry that they're not telling the whole story. And so we really want to think bigger than that about cognitive work, communication, and really interaction with patients. So my recent work has focused on the patient perspective. How do we communicate the use of AI to patients? We want to relieve the fear that they have that some new tools are sort of taking over the human work. And we think that we can do that with a more coordinated, transparent, responsive approach. Let them know how AI is being used and what that means for their care. And then collectively, for physicians, nurses, patients, we can create a system that's more trusted, it's more usable and safe, not just technically impressive.
Right. When you talk about that, when you say, I want to go a little bit deeper there, like that, maybe some of the indicators around, even if it's pajama time or some of the stuff where we're seeing a lot of positive impact, a lot of positive adoption, which we don't always see in technology and healthcare. What are some of the sort of possible, I guess, why do you question some of those positive impacts? Are there some, sort of other potentially negative things that you're concerned about? Or is it more, just that, are we always measuring the right thing? I mean, when it comes down to it.
Yeah, I think the measurement in healthcare is always hard. I think this one is particularly challenging. And we're really limited to a lot of the process metrics. I think our biggest concern is automation without adaptation. Like we're rolling things out, but we're not accounting for the variability of individual practices. And like any other health IT related thing, we worry about alert fatigue, workflow disruption, our clinicians spending more time fixing something than helping the patient. And so even when these tools are well intentioned, they might not be used or they might be unsafe. I do think we're hearing positive things. A lot of my examples are coming from the ambient digital scribe. When we figure out how to really integrate that well into practice, the clinicians are thrilled to have these tools that are helping them, right? That's a great example of being able to connect with the patient. We can make eye contact for this whole encounter. I don't need to be looking at the computer and taking notes. And we know that that really changes the experience for both the patient and the provider. Generally, I think we're measuring things like accuracy. Are a lot of these tools making the right decisions? Are they finding that abnormality in radiology image? And so certainly, again, there's tons of opportunity. We just want to make sure that we're doing it the right way, like the most transparent way, and we're fitting it right into the workflow.
Yeah, no, it's interesting. I mean, it's almost like because there's always unintended consequences. And even if you think back to the initial implementation of electronic health records, where, sort of patient safety was certainly the, sort of the impetus for all of it, right? I mean, it was, we knew we needed to get better at tracking care and that technology would help. But then the unintended consequences and the workflow impacts, sort of came about, right? But taking it back, and you mentioned the patient and kind of what do they want and what are they looking for in this, and maybe also what concerns do they have? You're doing a lot of research in that space. Tell us a little bit about, what they want to know and how, healthcare leaders can help them, adapt and use this technology best.
Yeah, sure. So we started with the study last year. We brought in, I think, 17 patients to talk about what they would like to know about AI. And then more recently, we've been doing co-design sessions in the evenings with a number of our patients from across the country, not just MedStar patients. And it's amazing the intelligence that they're bringing. Like, this is not some technology that they've never heard of before. Like, they're well aware, they're reading the articles. And so what we're learning is it's not necessarily the technical detail that they want. They just want transparency. They don't need to know like the algorithmic breakdown, but they do want to know, is AI being used? What is it doing? How is it helping the provider? How is it helping me? And then some really real concerns about, how's my data being protected? Is it secure? What if there's a data leak? And then I think the most interesting thing, not surprising, but most interesting is a human still involved in my care? And so they're recognizing that the AI can be a partner to the provider, but they don't want it to be a replacement. And so we're working on ways to frame this, to give them that information at different points in time. Are we talking about AI when you first schedule your appointment? Are you getting it in an informed consent document that you're signing? Could we have some, TikTok style videos for those that are interested? I think there's not a one size fits all. And so being able to message a similar message about how AI is being used in different ways will be really helpful. Again, talking about the ambient digital scribe, that's the one, we're using it across MedStar. I know many other facilities are as well. And that's being viewed as really positive because it's focused on the workflow and the documentation. But then when we talk about things like clinical interpretation, like you're, writing a message in the patient portal and it's an AI that's responding, or there's a chat bot that you're texting, but it's not a human, it's an AI. That's where the patients are, of course, they're more cautious. And so they want to know, is there a double check? Is a clinician looking at this before they sign off on it? Or is it really just an algorithm? And they're bringing us really good questions like, and if it is AI, what's the difference between me just using ChatGPT at home? Like, really, where is the benefit and where's the, what's the role of the healthcare system then in that? And so we talk a lot about clinician oversight. Again, I think it's just the transparency. If they knew that a provider was looking at the portal messages and editing them and responding them, they were looking at that EHR documentation. But I don't think that information is explained clearly to patients. I think we worry about those conversations about, I don't know, the health literacy and the understanding, but also the very practical concerns of like, you have a 15-minute primary care visit. And if we spend 10 minutes of those talking about this ambient digital scribe, I'm not going to be able to provide you the care that you need. So our goal is to not overwhelm patients, but give them the information that they need, hold ourselves accountable, let them know that that technology is there to support them and not substitute their care.
Yeah, I mean, I think it's like we always talk about sort of the technology needs to be invisible, right? And if you're spending half the time talking about what the technology might do or could do, then there's a drawback there. However, as it's new and there's an education and a part of that's certainly necessary for, and we've seen it both on the physician and the clinician side, but also with the patients. But I think it's really interesting in terms of where the concerns are. And of course, that concern desire to still have the physician, involved. What is the answer when they say, what's the difference between ChatGPT and the tools we're using?
I think we had an interesting conversation where one of the patients said, I know that the physicians have that little book that they pull out of their pocket, right? And if we were using that information to answer my questions, I would feel better. And so again, trying to help them understand in these different contexts, we're not using the ChatGPT that's pulling anything that exists and potentially misinformation, right? We have guardrails around the type of tools that we're using. We're using trusted sources. We're pointing towards evidence-based guidelines. So I think that's an important distinction. But perhaps the most important is that provider oversight, right? There's somebody double checking. Maybe a response has been drafted, but that's certainly not the final version. But we do need to think about that for these like agentic AI tools and the chatbots, and where does that oversight create more work for the provider than just allowing them to do the work in the first place? So there's certainly a trade-off.
Yeah, no, I was talking to the folks at Heidi Health actually about, because they have a very personalized tool for the clinicians that kind of eventually, as the tool learns, eliminates the need for that customization or that positioning. So, as these tools evolve, of course, there's so much kind of available for these to kind of get to that place, but it takes time, and as with, I think the privacy concerns, which we certainly saw. I mean, we see with the electronic health record, people want their information. That the call for transparency, that need for transparency, has been there with all tech. And I remember in the beginning when when health systems were just putting Alexa in health, in rooms, not necessarily to assist with care, but to assist with sort of more administrative, giving you access to your music and stuff. There was still privacy concerns and people turning off those devices. So as we look at, how to kind of bring the patient along in this journey and build them in the way that it's what they want, right? I mean, that it's improving that engagement. There's a lot to it. And then beyond the patient, when we talk about nurses and physicians, and there's been a lot of talk, and I love it around, because I think nurses are playing a real active role in the dialogue around how these tools should work, because they're there on the front lines and there's so much potential to alleviate that burden. What are you guys seeing in terms of your research, in terms of the work across different healthcare systems or there at MedStar between that difference of those tools?
Yeah, it's a great question because I don't think many people are talking about it. Like, we're really focused on the physician side. And that probably is the nature of the decision making that's happening. If we think about AI being more about decision support, diagnostic reasoning, that does fall more to the physicians. And so traditionally, I think the nurse tools are more about workflow orchestration, like more of those operational things about tasks, alerts. We're seeing some documentation, right, creating care plans. And so because they're more physician driven, I think we've left nurses out of the conversation. Our team is trying to change that. And so really bringing in nurses, talking about nursing focused design. We have one study right now working with nurses to understand if we were to create I know I'm using ChatGPT as like a large language model that was focused just on nurses, would they use that and what would they use it for? And so trying to understand, is it about communicating with the patient? Is it looking up evidence-based guidelines? Is it creating those care plans? Like, what are the actual tasks? And then, the how, what, where, when, why. Because a tool like that, you can imagine it would bring some value. But there are different hesitations and boundaries, I think, that nursing has that physicians don't. So that context is really important to us. I think there's a general recognition AI can help, right? It can help me do my work more efficiently. It can help me educate patients, prioritize tasks, whatever it is. But we want to unpack what those differences are and make sure that nursing is getting a tool that's not meant for physicians, right? We're giving them tools that are meant for their work, their level of professional judgment, their teamwork, right? All of the things that come specific to, the incredible work that the nurses are doing.
Yeah, it is interesting to think about the sort of potential as well as, some of the, it opens, there's a whole information overload to a certain degree of what is the potential of what these tools can do. And you still want to keep people within the guardrails of their own roles to optimize what it is they do and provide them those specific tools. So I do think that's really important, and people haven't made that distinction as much. We talked a little bit around like the patient errors, right? I mean, that's kind of where electronic health records were sort of seen to have the most impact. And this, when we think about the risk of AI, I mean, I'm constantly correcting my AI, and you spend a fair amount of time just checking it, making sure, did it do it right? Right. And when it comes to healthcare, that's really dangerous to some degree. And there's a lot of fear there. What do what are the guardrails that are being put in around AI to kind of prevent new types of errors that, we haven't even begun to think about that could come both at the nursing and physician level?
Yeah, it's interesting, the idea of this rework. And one thing comes to mind in speaking with providers about the ambient digital scribe. And one of our urgent care providers said, it just doesn't sound like me. It doesn't write like me. It doesn't talk like me. And I think that's an important distinction, that it's not just like spitting out information and people are, agreeing that then goes into the note. They want it to feel like they wrote it, right? Whether they're personal with their patients and they're recalling conversations that happened, or they're more directed and simple. So again, there's a lot of complexities here. I think with the human factors lens, there are certainly new types of errors. I think more about making old errors faster, right? Like we're able to do things more efficiently. And so a lot of it is those same errors that we haven't been able to solve. We're really focused on how we're using AI in the diagnostic safety space. And that's, this is the core human factor stuff that we love about how information is presented. How are we communicating and handling things like uncertainty? How are teams communicating and coordinating, and then acting on that AI input? And so I think there's a worry that like inherently the AI might be wrong, like it's inaccurate, it's made a mistake, but I think we still haven't solved these longstanding problems about how information is presented. You look in the electronic health record, we talk about hunting and gathering, how providers are going to like every page on that, in that tool, they're going to the medication list, they're going to their documentation, they're going to somebody else's documentation. There's a lot of inefficiency that we haven't figured out yet, where AI, I think, could really help about presenting information and not overloading, but really pointing providers to the most salient things. We've been thinking about different ways to present this information to both patients and providers, healthcare systems too. And one example we've been building off of is a nutrition label, where everyone can interpret a nutrition label about what the ingredients are and, some fast facts. And so trying to replicate that, is there a simple standardized summary that clarifies what the AI tool is doing, what it was trained to do, and what some of the limitations are? I think acknowledging there are limitations, let's focus on what they are, right? We know if this is, more sensitive or more specific, or what the predictive probabilities are, if we just shared that information, I think it would help users make more informed choices, right? I'm going to trust this, or I'm going to trust it, but with skepticism. But right now, I think it's sort of a black box. And so we're not messaging it at all. And so really thinking about making sure everyone has the information about the safety, again, that this idea of transparency, and then providers can calibrate their own confidence. They can understand that uncertainty, and they can detect when the AI might be wrong and when they need to spend a little bit more time really reviewing what the output is.
Yeah, no, it's super interesting. I mean, when you think about the need for it to have your voice and you want it to have your voice, but then if you make an error and a consistent error, do you then train that error into it, right? So how do we ensure that the tool is trained enough that it doesn't allow for the errors that impact patient care, but it allows that customization? And I mean, it reminds me of the conversations we had about the electronic health record around, is this one size fits all tool that, it wasn't specialty specific, and as we look at tailoring these large language models to specialty specific, clinicians and practice, and those, and whether it's, the various physician specialties, or as you said, the nurse workflows, how do we, ensure that it learns, and do that correctly from a human factor standpoint?
Yeah.
It's super interesting. I mean, and I think, where we can, where the risk, and sort of mitigate the risk, and are you guys looking specifically at kind of different specialties across those two?
Yeah. So it's interesting. We've talked about the different user groups, and then I think there's a few other dimensions, specialties being one, and thinking about local fit, the activities that are happening, the pace, the communication strategies, those are all obviously very different depending on the specialty. And so again, this one size does not fit all. When we're doing something in radiology, that workflow is different than primary care. Oncology is different than emergency medicine. And so for each of these, we want to make sure that we're tailoring the interface, right? The information that we're seeing, the output of the AI, but also things like the timing and the data flow. Like, it needs to fit into that environment that's specific to that specialty. The other really interesting thing that we're seeing is the level of experience. And again, this concern that like the AI is replacing the physician. In many instances, I know at MedStar, we hold back on the AI things for the junior trainees, right? Like, we want everyone to have those core skills. And I think explaining that to patients, right, to other stakeholders to understand, we're not just replacing and nobody's training on any of this. In primary care, for example, they don't get to use the ambient digital scribe until they're much further along in their training, or they have to learn how to listen and take notes. And those are, reviewed by the more senior staff. In radiology, for example, learners might be asked to read the film before an AI assisted interpretation comes in. And so, again, this idea of like de-skilling as an unintentional consequence of this, making sure that we're really thinking about it. We don't want to shortcut, any of these things with this technology that may not be here or look the same in 10 years. And so matching assistance, like what the AI is delivering to the specialty and also to the expertise, I think is huge.
Yeah, the whole de-skilling thing is just too big for my brain to handle, because I've been de-skilled for sure.
Yeah. Easy. It's hard not to, because there are so many things, right? Take my, 1,000-page paragraph and turn it into 200 words, right? And that happens in a second.
Right. Well, and you think even just to Google, where we, don't have to remember stuff anymore because we can just Google it, and so that over the last 15 years. And then this now, as it's like, now I don't have to look it up, but I don't actually have to formulate a sentence about it and think cohesively. But then it's, it is a different set of skills, and it will be, as it was with, sort of having all the information available, the skill becomes choosing the right information. And now that skill that clinicians, physicians, and pretty much anyone in the job of having to kind of express information to ensure that you've, both taken the correct information, but that it is it is expressed clearly to those patients, I think is so important. And you talked a little bit about kind of how do you, get the clinicians, the patients, what do you tell them and what do you share with them? And I think you guys have done a fair amount of work around kind of informed consent and what's involved there. What are some of the things that you're, to get into some of the specifics of what they need to understand that organizations should disclose?
Yeah. So I think there's some of the sort of basic, like, what is this thing? What's the purpose? What's the function? How is it being used? I do think patients want to know the context of this. And so in general, what are the benefits? And not just selfishly, like, what are the benefits for me? We're hearing patients say, like, this makes my provider's job easier. Like, tell me that, right? I want to know how this is impacting the provider, right? And the pajama time being a great example. Like, I would love for my physician to spend the evening with their kids, right? So, like, that's all I needed to know. Thank you. I'm okay with you using this for my care. But I do think it's a lot about, like, the trust piece and how is this really impacting me as a patient? How does this change anything for me? For the limitations and risks, like, what is it doing and what can it do? And maybe that question is actually, are you aware of the risks? Like, I might not need to know them, but I want to know that you know what they are. A lot of conversation about accountability and oversight and making sure that there are some checks and balances and some guardrails. And again, I might not need to know what they are, but I want to know that there's some sort of governance plan in place. I think the privacy, security, ownership one is huge. And this is similar for any study. Patients don't like being the data point, or they don't want to be the thing that the stuff is tested on. And so I think understanding this is secure, right? The audio recording from this very sensitive primary care visit is not going to end up on the internet somewhere. It's not going to be sold to a health insurance company. And patients are really seeing their voice in the same way that they think about, like, a blood sample or their genetics, right? And think about that, like AI and genomic medicine, and where that's going to go is going to be even more problematic. And so I think these are really good questions just at the heart of, like, what is this? And then one that keeps coming up is, and who can I talk to for more information? Which I think is great. Like, appreciating, give me this nutrition label, give me this informed consent, that's fine. I do want to go through our visit today. But what if I have more questions? And, like, is there an open forum? Who is responsible for this at MedStar so that I can come speak to them? Which again speaks to this, like, interest and intelligence, and, like, they want to be involved and they want to know more. They want to know how to get there.
Mm-hmm. Yeah, I mean, it's that balance, right? And it's kind of the transparency, the education, and informed consent, as we call it, right? I mean, you want to give them the tools to understand it, and then to even continue to use it, to engage them, as we, and then that balance of kind of ensuring safety and user experience, right? I mean, it comes down to that. So when you look back and when you look at the research and kind of all the work you've done on this over the years, as you're talking to healthcare executives and hospitals, who are looking to make these investments, what are some of your top recommendations of how to kind of balance that, ensuring the safety and that the user experience is kind of maintained, or at best, all of it, that it's improved?
Yeah. And I think, again, like, we're talking about AI, it is different in many ways, but similar to any other intervention. If you're worried about the end user, that's where you start, right? I think we're thinking about cost and we're thinking about implementation. Is this even doing the thing that the provider needs it to do, right? So starting with the end users, not the algorithm. That's why human factors testing is so important from day one, understanding what are the clinicians experiencing in these real settings. We do worry about edge cases, or we can simulate those. And then for patients, including them in the co-design too. And so, for us, our mission is about safety. It's also about equitable care, and not just innovation for innovation's sake. And so thinking about the human performance and the patient trust. I mean, I will say so much of medicine and technology and innovation is incredible. Like, the future is wild. But I think there's huge opportunities to think about tools that are really going to work for the patients that have gone maybe overlooked for some time. And so, for example, how many people actually read their discharge summaries? Not many, right? We see them crumpled up in the garbage cans of the hospital. Could we use AI to really know what you as a patient need? If I knew your reading level, if I knew your health literacy level, if I knew how you wanted to be communicated to, right? Do you want maybe softer, more, nuanced tones, or do you just want the facts? Right? I think there's huge opportunities in the way that things like an LLM, right, could customize and personalize and tailor care for patients that could make some big differences, some inroads in places that we haven't really been able to fix before. And that's just on the patient side. Similarly for the providers, right? Can we tailor and customize these things? Could the note sound like that provider, right? Could it write like that provider? And I think we're in the infancy of this. And, 10 months from now, we're going to be having a different conversation about what this looks like. But it really starts with the users and making sure that whatever we're developing is really meeting their needs and not at the sacrifice of safety or transparency.
Yeah. No, absolutely. Well, we always like to talk about what's good in healthcare. And that's we have the segment 5 good things in healthcare. So I always ask the last question, what are you most excited about? I feel like you might have touched on a little bit of it with that right there, because the future is bright and it's exciting. But if you had to think sort of big picture, what are what's the good thing about all of this, or even more broadly, that's coming in healthcare that you think that this is really going to have that positive impact?
Yeah, I think it probably is that personalization. I think for me, my good thing right now is doing this work in partnership with patients and providers. We've got a lot of exciting things in the mix. Can we develop feedback tools for providers about their performance, right? Can we customize information for patients? I think there's a lot of opportunity, but we're doing it with everybody at the table. And I mean, these sessions that we're doing with patients, my favorite thing right now, to hear their stories, understand their experiences, and say we're equal partners in this, right? And we're going to figure this out together. But we need to do that with just open, honest feedback and a starting point to know, what are you most worried about and how can I help fix that? And so we're excited to build some new things and get them out tested, starting with this language. How are we communicating the use of AI, and see what really resonates with patients and how we can improve it. And we plan to share that with anyone else that needs it. Nobody needs to reinvent the wheel. So if we find an informed consent script that patients really love and trust, to share that for other folks to use as well. So a lot more on the short horizon, within the next few months.
Yeah, no, I think that personalization piece is so key. And it's because we don't, in our normal healthcare system, pre-AI, we just don't have time to do the personalization that's needed to drive real patient engagement, or even literacy or education, or then change behaviors, And so with the tools that we have available and the access that they provide, it really does, sort of create that kind of promise of what technology has always said it would deliver. It makes it possible, right? So I love that. Well, thank you so much, Kristen. I could talk to you all day, but I know you have a very busy schedule. So, thanks so much for joining us. What's the best way for our audience to kind of find your research, get in touch?
Yeah, I think for anything AI human factors, through the MedStar National Center for Human Factors in Healthcare. And then on the patient side, AI, or really anything in healthcare, is our patient partner Diagnostic Center of Excellence. So I'll share that contact information. Would love to talk to anyone about really anything in this space. And thank you for the opportunity.
Awesome. Well, thanks so much, Kristen. Thanks to our audience. Until next time, keep transforming healthcare by remembering that the most sophisticated AI succeeds only when it serves humans who use it, both clinicians delivering the care and patients receiving it. Till next time, that's Megan Antonelli.